Hello everyone, today I'll be doing a presentation on the ACL prevention and rehabilitation. So who am I? I'm Lucia Schirripa. I'm from Staten Island, New York. I'm Italian American. I go to school in Brooklyn, New York at Siberian High School. I'm going to be senior in the fall. I play three varsity sports, soccer, lacrosse, track and field, and I do two club sports, soccer and lacrosse. I'm looking to study biology and psychology in college in hopes of becoming a sports medicine doctor and going to med school. And I'm presenting from Zoom. Why did I choose my research? I chose to research the ACL, preventative and rehabilitative ways to get athletes back on the field quicker because I'm an athlete myself. I played sports for over a decade, and five of my friends over the last 2 years have torn their ACL. And after my last friend did, I decided to do extensive research and dig deeper into their injury. And I also wanted to dip my toe in the water with a little bit of sports medicine to see what my future holds and if I really liked it. So here's some goals and aims for today. I'm going to develop a better understanding of what the ACL actually is, how it's torn, its epidemiology, consequences of it being torn, preventative methods, and rehabilitation methods. Here are some vocabulary words: anterior cruciate ligament, dosage effect, and strength. So, what is the anterior cruciate ligament? It's one of two cruciate ligaments that aid stabilization to the knee. It resides at the center of the knee and connects the femur to the tibia via the knee joint. It prevents the tibia from moving forward onto the femur over the knee by limiting excessive forward movement or over rotation of the knee. Dosage effect. This primarily is in terms of blood and antigen, but for this topic, it relates to strength training. How many times a week is an athlete training? 2 times versus 5 times a week is completely different. Also, how much effort they're being put in during those times. Two different athletes can be training 5 times a week, but athlete A trains harder than athlete B. They're going to see different effects and different results. Next is strength, the last one. This is a very basic vocabulary word, and most people think it's not too hard to define, but in terms of the ACL prevention and rehabilitation, it is not that easy. Tearing the ligament is not like pulling your hamstring. Preventative measures and rehabilitative measures will be further explained later, but it's important to make sure that everyone knows that strength for ACL recovery is very different. Before tearing your ACL, you are just building up pre-existing muscle, whereas rehab, you are actually trying to recreate muscle, rebuild that muscle, and then make that muscle stronger when the muscle is back. Okay, the anatomy and physiology of the ACL. It's a strong band of connective tissue and collagenous fibers. There's two different ridges, the lateral intercondyle ridge and the bifurcate ridge. The first one is the anterior boundary of the ACL. The second one is the ACL bundle, which is good to mention, is the isometric anterior medial bundle and the posterior lateral bundle. That is known for being more versatile with the ACL length, whereas the isometric anterior medial does not allow too much wiggle room for the ACL to stretch. With that, the ligament is around 32 millimeters long and 7 to 12 millimeters wide. How the injury actually occurs. It's a sudden change of direction, a pit or cut maneuver. A pop or snap can often be heard. And an example of this is an athlete could be changing direction super quick, and the body wasn't prepared for it, making the body go one way and the knee go the other, creating a non-contact ACL tear. Here's its epidemiology and the consequences. And just for a heads up, the epidemiology is only approximation, it is not exact. So 1 in 3,500 people tear their ACL every single year in the United States, and 400,000 ACL reconstructions are done every year. Women are at a higher risk than men, around a ratio female to male 4.5 to 1. Some people believe that this is because women have stronger hamstrings, not quadriceps, and that men have a stronger core and creates more of a balance than women. Also, soccer and basketball are the top two sports, with football coming in third. Here are some short-term and long-term consequences. Short-term include mental health, anxiety, and depression, which I'll touch on later, and immense amount of pain, obviously, when you tear it. Some athletes describe it as a disconnect of the leg, and the leg almost feels loose. since the knee connects the femur and the tibia. Long-term include a possibility of a re-tear and osteoarthritis, which is a type of knee pain, type of knee arthritis that occurs when the flexible tissue, otherwise known as the cartilage, um, wears down at the ends of the bones, and it occurs at bone joints. Here are some research engines I use: PubMed and Google Scholar, and those are some words I use to obtain all of my findings. Prevention. First big thing is strength. In my research, I always found that longer durations and multiple frequencies are recommended over shorter durations and single frequencies. Basically, what this means is, how long are you training for? 5 weeks. As I said, this goes along with the dosage effect. 5 times a week versus 2 times a week will have a difference. Even 1 time a week versus 1 time a month will have a vast difference. Multiple frequencies versus single frequencies. What are you actually doing? That's what frequencies are, kind of. The different types of exercises you do, which go along with the exercise movements, the big five: strength, plyometrics, agility, balance, flexibility. And these were recommended based on current events with various studies. The first is obvious, plain and simple: strength. This is traditional lifting of the weights. Muscles that lift more have more strength and stability, making them able to take a couple knocks and hits without getting seriously injured. The next is plyometrics, jump training, which muscles exert maximum force in short intervals of time, which is done in hopes that muscles get used to the fact that they're extending and contracting in short periods of time. That goes hand in hand with balance. When you're balanced, your core is right, everything is right. That goes hand in hand with agility, which allows for quicker movements. In ACL non-contact injuries, a bunch are from agility, the cutting and the pivoting, as previously mentioned. In strength, the cutting and the quickly changing of direction is the main cause of ACL non-contact injuries. And next is flexibility. Instead, that if you're more flexible, you're easier to change directions more quickly. Warm up. This is probably the most important part of the game, except for winning. Here are some focus points I put. Soft landing, knees over your toes, bend your knees and hips. These are the things that we should, and athletes as myself and other athletes should take note of. When we are jumping, are we landing softly? Are we landing abruptly? Are our knees behind our toes or really over our toes when we're squatting? Does your knees and your hips bend at the exact same time and move together? Mind and body are connected. These are great things to focus on when you're warming up to make sure your body is properly warming up. Now, it is said, doctors have said that the recommended time for warm up is 10 to 15 minutes, and that should be dynamic, which includes stagnant stretching, but also fast, hard sprints. This includes balancing, running, skipping, landing, squatting, and cutting. All of these mimicking game-like experiences, so the body is warmed up, ready to go when a game-like experience as such happens. These are the next two most underrated: sleep and eating right. You must get at least 8 hours of sleep. 7 to 8 hours, 7 to 9 hours, anything in that range. The mind and body are both connected. When your mind is tired, your body is tired, leaving your body susceptible to more injury. Eating right. This is the big five: carbohydrates, protein, healthy fats, fruits, and nuts, and it's also important to include dairy in there. Dairy grows your bone health. Healthier bones equals healthier life. It's important to add too that protein builds muscle. So the more protein you eat, the more muscle you can gain in your muscles, which is super important. Now to the rehabilitation side. Is it important to note again that strength again is one super important, that I said before in the vocab section, but rehabilitation, you do in fact have to rebuild that muscle that is now lost. Muscle atrophy after ACL surgery is tremendous. You lose almost like 95% of your actual muscle. So this time we actually need to rebuild that muscle and then build it up to the point where you can run on it now and you feel safe and all of the above. So what we're going to discuss is two things: full bending of the knee, which is approximately 6 weeks. Now, everyone's time is different. That's very important to note. Everyone's recovery is different. Some people have very slow recovery. Some people have recovered as quick as 3 to 4 weeks. So again, the normal is 4 to 6 weeks, but 8 weeks or 10 weeks is not terrible. And the full bending of the knee is 130 to 140 degrees. And within a week or 2 weeks, you should be able to bend your knee about 90 degrees, which means you're on the right track. The second is the quadricep and hamstring training. Going back to those 5 groups of exercising: strength, plyometrics, agility, balance, flexibility. All of these will help you regain that muscle that was lost. And this time they should be done with a little bit less weight, but longer reps. This allows your muscles to regain that strength rather than heavier weight, shorter reps, which would just make the muscle stronger. Also, tension bands, as seen as the photo, is super great for recharging your muscles and getting them to work more on that restriction, getting back into that athletic stance. Rehabilitation, dosage effects again. How many days does the athlete attend physical therapy? Are they working hard enough? Are they pushing their limit to the point where there is progress? Now, with all of this, I talked about how you should do as much as possible, but there also is something as too much. During this time, you have a high chance of re-tear, and osteoarthritis is knocking on your door. So you have to make sure you're not doing too much and overpressuring yourself to do it because you want to get back on the field, or doing it safely. Doctors recommend you go to physical therapy 2 to 3 times a week and do stretching on your own every single day. As I said before, I wanted to touch on mental health. I think it's super important. Doctors explain to their patients that they need to tell themselves, I want to get better. I want to get back to my sport. Mind and body are connected, and studies show that the more your body wants to, the more your mind wants to get back to the sport and do better, the more your body will respond and create better chances and have a better recovery time. Along the negative side of this is depression and anxiety rates are at an all-time high after you tear your ACL, and people have FOMO, or the fear of missing out. They're very lonely. This is according to many studies showing that after you tear your ACL, especially if you're in season, your team does a lot of activities and you're not able to attend because of your injury. This leads to depression and anxiety, which once again leads to less chances of getting better quicker. So as soon as the athlete can get that under control, their mind and body can be back in sync and rehab can go as planned. So, conclusion. We talked about prevention and rehabilitation. Strength training, building up pre-existing muscle. Warm up, mimicking game-like scenarios such as cutting, jumping, pivoting. Sleeping 8 hours. Mind and body are connected. Remember that. Eating right. The 5 major food groups. They are carbohydrates, proteins, healthy fats. They are fruits, nuts, all of that stuff are really good to eat and really, really helpful. And then rehabilitation, you have strength training, full bending of the knee, the 130 to 148 degrees. The hamstring quadricep training, your 5 major groups. You have your strength, your plyometrics, your agility, your balance, your flexibility. All those are super important. And then your mental health. Again, once again, mind and body are connected. When your mind wants to do it, your body will do it. And depression and anxiety levels are at an increased high, so they need to remember they want to get back on that field, they want to do better, and that will help them get over that depression and anxiety. Thank you guys so much for watching. I hope you learned a little bit more about ACLs and sports medicine as a whole. Have a good day.